Good morning, everyone. I would like to welcome you all in our In-Service Education 2021. First, I'd like to congratulate all the newly hired nurses who are able to join us today. My name is Julianne C. Visaya, and I am one of your training officer for this month of May. I am tasked by our training director to report all about the Glasgow Coma scale. And for the teaching strategies that I will be using, I will be utilizing a PowerPoint presentation with audio-visual lecture. Okay, so let us now begin. So for our learning objectives, to identify the use of a Glasgow Coma scale, to be able to accurately score the level of consciousness of a patient, and to be able to know the limitations in scoring the GCS. First, let us know where did this GCS come from and who made this scale. In 1974, it was first published at the University of Glasgow by the neurosurgery professors Graham Teasdale and Brian Jeanette. We can see from the picture those who are responsible in creating this Glasgow Coma scale. So we can observe that the Glasgow was coined from the university in which it was first published. Next, so what is the use of a Glasgow Coma scale? The Glasgow Coma scale allows healthcare professionals to consistently evaluate the level of consciousness of a patient. It is very important for us to know, especially healthcare providers and nurses, how to assess the level of consciousness of a patient. Especially in our company, we are receiving patients who are from trauma. We are rehabilitating them. We are assisting them to be able to reach their optimal level of functioning. And so we need to constantly evaluate their level of consciousness and if they are improving or deteriorating. And so we can manage from that assessment that we have. The regular assessments of a patient's GCS can identify early signs of deterioration. Then we have three aspects of responsiveness in this scale. We have the eye-opening, the motor, and the verbal responses that we will tackle later on. For the scoring, the highest possible score is 15 and the lowest possible score is 3. Now, let us discuss the three aspects of responsiveness by starting off with the eye response. The maximum score you can give for eye response is the score of 4. So how do we do this? You score 4 if you observe that the patient is spontaneously opening his eyes. You score the patient 3 if the patient is not spontaneously opening his eyes and he just opened his eyes the time that you speak to him or you ask him questions. Like for example, hello, can you open your eyes? Or hello, are you okay? Then you score 2 if the patient will respond only if you will inflict or you will give pain to the patient. For example, you will do trapezius squeeze or supraorbital pressure, or you will squeeze the fingertips of the patient and he will open his eyes. You will score the patient 2. But if there is no response at all, that is the time that you will score the patient as 1. Next. Now for the verbal response, the maximum score you can give here is 5. You score the patient 5 if he is oriented. Oriented in a way that he will be able to answer all your questions appropriately. Like you ask, do you know what month it is? If he will answer the correct month, then you will score him 5. You will score the patient 4 if ever he is able to answer but in a way that he is confused or he is unsure of his answer. You will score the patient 3 if he will answer you that is not related to your question, like it is out of context. And you will score the patient 2 if he is producing incomprehensible sounds, moaning or babbling, and 1 if there is no response at all. So next is the motor response. The maximum score that you can give is 6. You score 6 if the patient is able to obey your command, like for example, grip my finger or make a fist. You score 5, 4, 3, 2, and 1 according to the response when you give a painful stimuli to the patient. So for 5, when the patient will localize the pain, or he will reach to the area where you inflict pain, like for example you do the trapezius squeeze, then you will score the patient 5. But if you do the squeeze and the patient will withdraw to the pain, then you will score 4. This withdrawal to pain is a normal response reflex. And then you will score 3 if there will be abnormal flexion or decorticate, and 2 if there will be abnormal extension or decerebrae. I will show you a video later on to compare the two, and you will score 1 if there is no response at all. So let us now watch a video comparing decorticate and decerebrae.
This video will introduce you to decorticate and decerebrate posturing. First, we'll start with decorticate posturing. You'll see the patient's arms abducted and their arms flexed up against their chest. Their legs will be plantar flexed with their knees extended, and they'll be in a very tight position. This would earn a score of 3 on the Glasgow Coma scale, and it's always associated with disinhibition of the red nucleus and disruption of the lateral corticospinal tract. Next, we'll move to decerebrate posturing. You notice that the posture is very much the same with plantar flexion of the feet and extension of the knees. However, the patient's arms have moved to an adducted, pronated, and wrist flexion state. This would earn a score of 2 on the Glasgow Coma scale, and it's caused by brainstem damage, specifically below the level of the red nucleus.
Okay, so you should always remember that you score 3 if there is abnormal flexion or decorticate, and 2 if there is a flexion, extension, or decerebrae. There are important considerations and limitations in scoring for the GCS. For the eye response, if the patient cannot open their eyes, like there is edema, there is trauma, or there is adjusting, then you will place not testable. For the verbal response, if the patient is intubated, or there is other factors interfering their ability to communicate, then you will place not testable. For the motor response, if the patient is unable to provide a motor response, like he is paralytic, he is having spina bifida, then this should be documented as not testable as well. Also for children, since like for the age below 36 months, where the verbal performance would be expected to be poor, then it has also a limited applicability. So I think that would be all for my topic. Okay, so how do we interpret the scores that we get from the scale? As what I have said earlier, the highest possible score that you can give overall is 15, while the lowest is 3. There is no 2, 1, or 0 score. For the GCS 13 to 15, the patient is having a mild head injury. If the patient has 9 to 12, then the patient has moderate head injury. And if the patient is having a score of 3 to 8, then the patient is having a severe head injury that may suggest a need for intubation or a more frequent monitoring. So it is really very important for us to know how to scale, how to score, and how to interpret these scores. Now let us apply what I have taught you a while ago. I have here 3 different scenarios and we will be scoring this one by one. Okay, so first, a patient fell while rock climbing. When you apply a deep sternal rub, this is the painful stimuli. He extends his arms and legs. This is the motor response and shows no other response. So automatically our eye and verbal is scored 1. And we will score motor, which is there is extension of his arms and legs. Let's see here, motor response extension is 2, or we also call this decerebrate. So our total score is 4. So the patient is having a severe head injury. Yeah. Next, a 75-year-old male rubs his chest and tells you it really hurts. This is verbal. He tells you he want to go to the hospital, verbal, and you help him walk to the stretcher so he can move, motor. So our score for motor here is 6 because he is able to walk with minimal assistance. For verbal, he is vocal, he is oriented. So we score him 5. And the patient obviously here is awake. So the score is 4. The patient is scored now 15, which is the highest as possible score. Next is a 73-year-old patient who looks at you when you speak. This is I. When you ask her the date, she says blue. Oh, inappropriate words. And you note left-sided weakness when she grips your finger. This is the motor. So he looks at you when you speak to her. So that is scored 3 when there is a verbal command or you speak to her. Then you are asking the patient a question and he answers out of context. It's not related to your question. Then this will automatically score 3. And the motor response is he obeys your command 6. Even though he is weak, she still obey your command, so she still has a score of 6. So the total then is 12. So the patient has a moderate head injury. Okay, so this is how you are gonna score when you observe a patient, and you are gonna interpret the scores and report accordingly to your physician. Okay. You have learned a lot from my discussion today, and once again, congratulations to our newly hired nurses. Have a good day, everyone. Thank you.